Hey everyone, this is Dr. Sree and you're watching Ask Dr. Sree. Let's discuss about trekking after recovering from a COVID infection today. Srinath from Chennai sent me a worried email asking if he could plan a high altitude trek after recovering from COVID recently. Let me read out his email for you. Hi Dr. Sree, this is Srinath from Chennai. I recovered from COVID completely and tested negative 2 weeks ago. I wanted to plan a high altitude trek during the October holidays, but I'm unsure if I can go ahead so quickly post recovery. What do you suggest? If I can go ahead, do you have any tips on how I can prepare for the trek? As a trekker myself, I can quite understand the longing to go back to the mountains and have a beautiful trek after being cooped up at home with the lockdowns and the stress of the pandemic. The good news is, even after recovering from a COVID infection, you can definitely do a high altitude trek if you keep a few things in mind. Let's first talk about how soon you can plan your high altitude trek after you recover from COVID. If you've had a mild case of infection, that is, if your oxygen saturation has always remained above 90% and you don't have a lot of symptoms now, then I suggest giving a time of 1 month before you plan your trek. Make sure that you use this month to prepare well for it. Also, I suggest start preparing for the trek first in the first 2 weeks, and then once you're comfortable with your fitness levels, go ahead and book for the trek then. If you've had a more severe case of COVID and are still experiencing breathlessness and post-viral tiredness, I would recommend giving at least 3 to 4 months before you plan your trek. This gives your body enough time to recover completely and get back to your pre-COVID fitness levels. One thing I would absolutely recommend is starting out with exercise soon after you recover from COVID. It's been known to be beneficial in improving your lung function and aiding your recovery. However, I recommend starting out slow. Begin your exercise routine with brisk walking in the beginning, and after a couple of weeks, you can progress to jogging. Make sure that you pace yourself well and don't overexert yourself. You can also do functional exercises like planks, push-ups and squats as a part of your routine after 2 weeks. Simple breathing exercises and pranayam have been highly beneficial in improving lung capacity post-COVID. I would strongly suggest you start these as well. One of the most important things to remember when you're recovering from COVID is the right diet. Have foods that are rich in protein and also rich in vitamin C and E. Processed foods and sugary foods are an absolute no. Trust me when I say having the right kind of diet really helps you in getting back your pre-COVID health. It really worked for me. If you're doing a trek that goes up to 14,000 feet or above, I'd strongly recommend going on a preventive course of Diamox. So I've noticed a lot of trekkers feel like if they take Diamox, it makes them like less of a trekker, and they feel like they shouldn't take Diamox and they should be able to complete the trek successfully without taking Diamox. This is a misconception. There's absolutely nothing wrong with taking a preventive course of Diamox, especially if you're planning your trek soon after recovering from COVID. I myself did a moderate to difficult Himalayan trek after I recovered from COVID 2 months later, and I was on a preventive course of Diamox. I was able to complete the trek successfully. A lot of trekkers have asked me if they can do a Himalayan trek soon after getting their vaccination dose. If you're feeling absolutely fine and you don't have any side effects and you've prepared well for the trek too, you can definitely do a Himalayan trek after getting vaccinated. There are no contraindications to this. I think I've covered everything you need to know if you're planning a Himalayan trek after recovering from COVID. I definitely think you should go ahead and plan a trek because all of us have been cooped up at home for too long, and it's really time that we go to the mountains and soak in some peace. If you have any other questions in the comments, do let me know and I'll gladly help you out. Also, if you have any other medical conditions that you would like me to cover in this series, feel free to write to me at drshree@indiahikes.com and I'll gladly answer them in the next series.